Approximately 45 minutes.
Sí, que suba. Que nos espera ella en el cuarto mismo.
We have dates available for the month of July. We have promotion for the gastric, but if you book today, we're gonna give you a special price. Just today.
So hello to those that what we're doing today, we're doing a gastric sleeve surgery. So this gastric sleeve surgery is actually a procedure that's gonna help you lose all the weight that you need to lose, but mainly it's gonna keep you safe and it's gonna keep you with the good nutrition that you always have.
How much time is from work?
It's actually 2 or 3 days after you recover, after you discharge from the hospital. For example, you're gonna be here in the hospital for 1, 2 nights. You're gonna be released on the third day, so you're gonna be here, for example, Monday, Tuesday, Wednesday. So you're gonna be released on Wednesday, and actually you could take 2 or 3 days off from work, and you're gonna be good. You won't have no problems. Basically, the only thing that you have to adapt is to eat the way that nutritionist would ask you to eat, many times a day, right? Uh, Good food, always good quality, and eat slowly. So it's important you know you need to take your time to eat. So right now you won't be able to eat as fast as you did before. You're going to be able to eat probably slowly, right? Just biting enough, taking your time. All right? Okay, so the main thing that you have to know is that with the gastric sleeve, you're gonna have a really good time with the weight loss. For example, let's say you start with 230 pounds. You're gonna be losing 20 pounds the first month, and you're gonna continuously keep on losing weight in good enough so you can actually recover, right? In 2 or 3 months, you're gonna be probably the closest you're gonna be to your ideal weight, probably losing even 30 to 40 pounds total. And then if we can actually see you in 6 to 8 months, you're definitely gonna be your ideal weight. So what's your ideal weight? It's important you know that BMI is the main thing that you have to calculate before doing a gastric sleeve surgery. For example, you're gonna be having your weight and your height, and we're gonna actually calculate it with that. So if you know it in kilos and centimeters, what you have to do is in kilos, you're gonna have to divide it through your height 2 times, and that's gonna be your BMI. If you actually do it in pounds, you're gonna have to go to the application. So just go BMI calculator on Google, and you're gonna find 2 or 3 BMI calculators. So you can actually make sure that you got the best calculation on knowing the actual risk of your surgery. So, can you come for consultation? Yes, you can come for consultation. We're here located in Tijuana, Mexico, so we'll be happy to receive you in our facilities. I'm going to be speaking through the surgery itself. So usually the surgery it's not that complex. Let's say you're going to be having actual few days of to recover from your diet. You're gonna be having liquid diet for 10 days. After those 10 days, you're gonna start with puree. So you're gonna be only eating puree. And when you finish those 20 days, you're gonna start with the other 10 days, which is gonna be solid food with small pieces. So you're gonna be having just a small piece of food, and you're gonna be having enough time to actually recover from the gastric sleeve from a month of your eating habits, and you're gonna start just eating better every time, right? In the second month, you're going to actually be after the first month, you're gonna be starting with your normal diet. So it's like a baby. You're gonna start with small pieces. You're gonna start trying different kind of consistency, different kind of food, and you're going to actually start getting better with your eating habits. So let's say I go to 200 and I still looking normal. I don't look too big, but I still concern my cosmetic and also the way I feel, the way I interact with my kids, the way I actually run in the park, the way actually I do my life overall. So if you're really struggling with that, the gastric sleeve will always provide you the best of the outcomes Whether you try exercising, whether you try dieting, it's always a rebalancing. If you take pills, there's more rebalancing. The gastric sleeve will not give you rebalancing, and it would be even helped to get it if you are only 200, 300 pounds and you're not looking that big, but you're always concerned about it. You already have liposuction, already have tummy tuck, and you're still concerned, not happy with the way you weight and the way you look, the size you weight,
What is
definitely is a good chance.
they are asking, what is the ideal BMI for this procedure?
Okay, well, the ideal BMI is 35 on top. If you're 30 and you already had plastic surgery, you would be a good candidate to do the surgery, because the skin that we removed, the lipo that we did, it's already tissue that we took out from your body that is gonna weight. So of course you have to count that. So it's important that you know, if you already have plastic surgery and you're over 30, you will be a good candidate. If you didn't have the gastric, the plastic sleeve surgery, but you still want to get it and you're only 30, 31, 32 BMI, let's talk about it. Maybe there's a chance that you can get the surgery. Mostly if you really struggle with your weight, you have a chance to get the gastric sleeve surgery, but not under 30. The only thing that you have to be on is that you actually not, that you're still gonna have to have obesity to be able to perform this surgery. If you're overweight only, so under 29, you're not candidate to this procedure.
Or if you are looking to get pregnant?
So one thing is, this patient right now, she did not need the gastric sleeve for any cosmetic or health issues. She's 35 BMI, but she cannot get kids. She cannot get pregnant. So having the gastric sleeve is gonna help her ovarian, polycystic ovarian is gonna help her with the menstrual cycle, and she's going to be able to have her kid. I'm gonna be posting her pictures in 6 months or 1 year, depending on what she talks to the doctor. When she gets pregnant, she's gonna get pregnant. That's something you're gonna see.
One patient is saying, I'm 38 BMI with no previous surgeries. 38.
Definitely a great candidate to do the gastric sleeve surgery. One thing that you have to know is this surgery is not dangerous. This surgery is small, it's done through laparoscopic comb. I want you to see the ports. It's just small incisions. Vamos a ver las incisiones. It's only small incisions right there. There are only 3 incisions, less than 1 centimeter. There is no chance. There is no chance of getting a big scar. It's just a small scar. So there is nothing that is going to be concerning us regarding the scar. Right? It's going to be a small and simple one. You will not have issues with it. So one thing that you have to remember is that the way to calculate the risk of a surgery is 3 ways. How big is the incision? 3 small incisions of 1 centimeter. How long is the surgery? 40 minutes? 40 minutes. How much are we going to take? The stomach? 200 grams? That's nothing. So that's the risk. That's a low risk surgery. So this will not be anything comparable to liposuction. I'm not saying liposuction is dangerous, but of course, if you compare the difference between one of them, 10 times higher. Liposuction is 10 times higher the risk comparing a gastric sleeve. How much I'm gonna lose with the gastric sleeve? I'm gonna lose 30, 50, 60, 100 pounds. How much am I gonna lose with lipo? 10 pounds. How long am I gonna take to recover from liposuction? 20 days, 15 days? How long am I gonna take to recover from the gastric sleeve? 3 days. How much does it cost? The same price. So what would you choose? Safety and wellness and improvement in your health? Or just a small cosmetic procedure that it will not be enough if you struggle with weight?
For a patient that is diabetic
For a diabetic patient
and hypothyroidismo
and
también.
hypothyroidism, okay, if you struggle with that, we have to prepare you for the surgery. Of course, you have to go to your doctor. Of course, you have to get the best recommendations. But if you get the surgery, most likely the gastric sleeve is going to solve your diabetes problem, and your hypothyroidism won't be fixed, but you will slow down the doses, since the doses is calculated by kilograms. So if you lose weight, you need less medication. Of course, the diabetes is going to be completely solved. Of course, this oral medication diabetes. If you inject insulin, we have to talk about it because there is something even better for diabetes that is called the gastric bypass. So gastric bypass is an amazing procedure to do it if you're diabetic.
You said, how long do I?
So I'm gonna show you right here the stomach, right? The stomach right here is already done. I know that you guys don't like to watch this because that's bloody. Of course, it is the procedure itself. And that right there that you see, that's a small tube that it was performed.
You said, after getting the surgery, how long do you have to wait to get pregnant?
Okay, if you had the surgery already to get pregnant, I would recommend a year. But you can do it after 6 months, right? The thing is that we had patients that got pregnant in the first month. Why that happened? I don't know. Maybe because they didn't know and they didn't believe in the procedure. So if you didn't believe in the procedure and you're not taking care of yourself, how come you can get not like this? After the first month, you're gonna be pregnant. But it really concerned us. So as a doctor, we told the patient, we're gonna follow you up with your gynecologist or with your obstetric doctor. We're gonna follow you up at the same time. So we saw her recovery, and she was actually losing weight, and she was gaining weight with the kid as well. So that she had two different kinds of things. She was gaining weight and she was losing weight at the same time, and she's completely healthy. She had her kid good. She already had her weight loss at the same time. I'm not saying that I recommend that, but that's what happened. But the thing is that after 6 months, I would recommend after a year to get pregnant if you already had the gastric sleeve. José preguntó algo.
Que se la quiere hacer José.
Jose, no, you're not a great candidate for this procedure. You're amazing. So hopefully we're gonna be posting your pictures if you don't let us. But the thing is that we love your result, Jose. So thank you so much for losing that weight by yourself and looking that amazing. You look great.
Hay una paciente dice, I did my BBL and I'm so happy, love my results. Thank you, doctor. Son lo máximo.
Yes.
Sí, a ver.
Okay, so what we're gonna be watching right now, we're gonna be watching the stomach just put into the side what we do as cut. So this is the size of the stomach that it was removed. So there's a lot of the stomach being removed where it took it out. We're already going to be pulling it out, but that's the size of the stomach. And the thing with the stomach is that it's not only bad, right? It's not only big. It's not the only bad thing is not that it's big. Is that it also creates ghrelin. So most of the times we've seen in studies that patients with great problems, right? With great problems, they definitely had a higher release of ghrelin. So since they had a high release of ghrelin, they were having obesity problems. So how do you know if you have a high ghrelin release? You know, you're gonna be bigger and you're gonna be gaining weight faster and you're gonna call yourself that you're big bone. But the thing is that you're probably producing too much ghrelin. So if you're already producing too much ghrelin, what I would recommend is to perform the gastric sleeve. So sometimes obesity is not your fault, it's really over ghrelin release. So you have to get the surgery to get it out. Getting a small stomach, you're gonna have no weight issues, and you're gonna start losing weight. Now you're gonna start feeling like a skinny person. You're gonna start feeling young. You're gonna start feeling not too much hunger. You will not feel that heavy. You will not need that much carbs.
Your knees are not gonna hurt.
Your knees won't hurt, but the thing is that having the ghrelin removed is gonna make it easier for you to eat. So for example, let's say you say, I don't want to get the gastric sleeve because I might be hungry and I might struggle. So if you already have that problem, right? Let's see the stomach. So we already took out the whole ghrelin. So obesity is not your fault. It's something that it's made by your over release of hormones, which is basically having over release of ghrelin. So that's gonna be causing a lot of the issues with the weight. So what we would suggest you to is to actually get the gastric sleeve surgery. It's performed easily, and you're gonna have a better time on losing weight. You will not issue anymore. You will not feel hungry, so you're gonna have a really fast metabolism, which you're gonna be able to actually lose all this weight. So would you believe that Frida got the gastric sleeve surgery and she weighed 230 pounds? You would never guess that. She looks amazing and she hasn't even got the tummy tuck yet.
Yeah.
So you're gonna be watching her get the tummy tuck performed. But right now, definitely I can guarantee you that she looks skinny, she looks small boned. So she did not look like that before.
No.
So what you can do is basically it's that that getting the grading removed, getting the gastric sleeve removed is gonna help you to have the body of your dreams. So one of the things that you have to know is that this team of the gastric sleeve is the team that we have more privilege to have on, which is only board certified team. They have an anesthesiologist, a cardio anesthesiologist that is going to be here watching you, and he gets an intensive care cardiologist that is going to come in and see you before and after the surgery, so you're going to have an amazing result with the safety that you need to have. You need to know that the gastric sleeve is low in complications, but the complications are hard. So you do not want to go to the cheapest doctor that you find in Tijuana that performs the gastric sleeve, because it seems like everybody's performing gastric sleeves right now. But you have to get a certified team. So I'm glad to present our doctor, which is a double board certified doctor, has double certifications in the United States and in Tijuana and in Mexico, and we can prove that. So if you need to see our certification of double board certification, you can actually ask for it and we'll be happy to show it to you. You can ask for the double certification if you want to see it. So this is a great team, a great bariatric team. So I'm going to show you just a little bit of the ending of the surgery. So it's been only 40 minutes. It's been only 40 minutes. So if you have any questions, just let me know, all right? So I see what you're gonna be watching right now. It's how they're gonna be actually putting the drain now, which is the awful drain that we're gonna have to pull after the surgery, which it won't be that bad. I know that I might be concerned about it, but it's just not going to be that bad. So one of the things that you have to see, all the girls that are nurses right here in our live videos, there's gonna be some nursing. Right? I know that there's some nurses watching this. So we're gonna be putting a plaque drain. So this plaque drain, so do you guys know this drain? So if you're a nurse and you know this drain, just say yes. All right, we would like to see if you know the drain that we're putting. So that drain that we're putting right there, we're gonna pull it out before you leave. So we won't ask you to take it home. So you're gonna be taking it out the day that you leave the hospital. So on the third day of your surgery. And that is a plaque drain, which is a soft gel drain that is gonna be inside of you. So he's gonna be pulling the gas out. So while he pulls the gas out, the stomach is gonna collapse and everything is gonna be closed. And we're gonna seal everything and suture everything so we can get the best suture. And you have to know that our doctors in Bath got some pulse training. So their pulse and their hand is just skill. So they all suture great, right? The suturing, it's just the training of microsurgery training. So microsurgery training gives you the skill of suturing small sutures, right? We're gonna be able to suture small, tiny wounds with the best quality of suturing that is gonna be ending up in a line scar. Online scar, which I can gladly tell you that we do have the training on the pulse training on microsurgery. So microsurgery will give you the advantage of doing a small closure. Can you do the gastric sleeve if your BMI is 28? We have to discuss it right now. So if you wanna send us a DM, we wanna know your medical history and we can talk about it. All right, well, thank you so much. It's been it. So thank you for watching. So we'll keep you posted. So this is Dr. Sergio Verduzco from Life Plastic Surgery. This is the team of the bariatric team, right? Thank you so much, and we'll see you soon. Bye. How did everything go, doctor?
Everything's fine. Surgery is done. One more gastric sleeve.